Hi, everyone. This is the question of the week, and I'm so grateful that Dr. Zimon has agreed to answer the question of the week. We're coming off of October. We're almost to Halloween, and as we talked all month about October being infant loss and miscarriage month, and bringing that into the light and talking about you're really not alone with that, although you might be feeling that. I think it was so appropriate because some of the questions that came up from our month discussion about that is, how quickly should you start trying again? So thank you so much for being here today. I so appreciate your time and your expertise about that. I know. So hi, how are you?
Hi, Kristen. Yeah, I'm so happy to be here and be part of this segment. And I care a lot about this topic. And I think it's great that you're shedding some light and awareness about this and helping, women answer this question. So yeah, go ahead. I think you were going to say a little bit on your perspective about what women should do and how long they should wait.
Well, when we were first trying, my first pregnancy was an ectopic pregnancy, and I didn't even know anything about ectopic pregnancies. And, unfortunately, I share that through my books, but it was such a debilitating loss, both physically and emotionally. And, I remember afterwards thinking, I'm going to try right away. I'm going to, don't hold me back. I'm just going to, pull up my big girl panties and move on. And physically, I was just not able. And so I think, looking at the mind, body, soul, but for you to talk about the body and when do you recommend that after you have a loss, even if it's a chemical pregnancy, what do you recommend to your patients?
Right. Well, it does vary a little bit. I mean, I think that, you touched on a real key part of this. It's not as simple as whether you're mentally ready or whether you're physically ready or any combination of those things. You really have to look at all sides of it. From a medical standpoint, it really depends on where we are in the spectrum of prior obstetrical history. Have there been losses before? How far along did this loss happen? After how long into pregnancy? And generally we don't ask people to wait too long. But I think the key thing would be that you make sure that everything is cleared medically, right? That there isn't some advice or some testing that your doctor wants to do to make sure that either if losses can be prevented in the future, that we identify that, or that there aren't any complications of that loss that are going on right now. And then, we have to make sure the menstrual cycle is back into gear. And it does take some time. It takes at least a month, but it could take 5-6 weeks or longer. So that's the medical side of things. But I'd be remiss to say that's the only component that we factor in when deciding whether to go ahead again. And that would be, the other component would be that, are you ready? Are you ready emotionally, physically, socially? I mean, and can you even take this on at this point?
Right, right. I know for me, after the loss, I thought it was all that and more. I was up and dressed, and from the outside looking in, you couldn't know. You wouldn't know because it was invisible. People don't know that because I was carrying on daily activities. But I remember one day just being in Target, doing my regular Target run, getting those tissues and toilet paper and abandoning the cart and running to the car and just broke. Right. And I thought, oh, geez, I need to rethink this. I really need to rethink, moving forward, because I think, and I'm looking to you to I'm sure that's echoed through other women that you speak with, that, emotionally it's just under the surface, and that's okay. But that has to be, talked about too before moving forward.
Yeah, and it's great that you say that. And I think that's going to help a lot of women to hear you share that, because I think no one expects a loss. So all of a sudden you're going along your way, you think you're pregnant, you have a due date in your mind, and this horrible thing happens and you have to reset. But you still want to kind of keep life business as usual. So it's very common for me to hear people say that. And the other thing is that a lot of people don't know. Right. They didn't know they were pregnant. And they often don't know. Their world around them, their supports don't know, and maybe their close supports do, but even sometimes those people don't know that a woman has gone through that. And so there's that push to just keep going. And then there's this inner strength component that everybody feels like, I can do this is fine, just like you were describing. but you haven't taken that time to say, okay, I'm ready, I'm healed, I can go on. So, and, I have to blame the medical community a little bit. Our data suggests that you really don't have to wait, provided all the medical clearance has happened. Like I mentioned earlier, there weren't other tests or, some concern about whether this would be a recurrent problem. If you're medically cleared to go, we say go ahead, but that doesn't even have to, right? So, and I think that's where you got to check in and see what you need to do to be ready. Another piece of this is women feel the biological clock, and they feel that they cannot miss that time. And now not only are they no longer pregnant, but they just lost 2 months or 3 months or 4 months, and they can't bear the idea of taking another month or two, or even seeing another birthday come and they're pregnant. So it's very complex. And I don't think there's an answer. I think you have to use all your supports, all your resources, your doctor, your mental health professional, whoever else, to help you decide when it is the right time to go and try again.
Well, what is so amazing when I get the privilege of talking to women is, there's 2 questions that I always bring up. What do you feel and what do you need?
Yes.
And if you bring up those 2 questions to yourself and, be curious about where you are, then, you're going to know what's right for you. And the other point too, for me, was that I was so blinded by the pressure, a self-imposed pressure to become pregnant, that I thought once I made a decision, that was it. I had to stay within that lane. But what I know now that I wish I knew then was, us girls have a right to change our mind.
Exactly. That's true. And take a break. There's nothing wrong with taking a break. We talk about that a lot. I'll have those conversations with my patients, with my staff a lot, that, it is okay. You can get off that path and change your mind for a little bit and take that break, or maybe even revisit whether you need to be pregnant right now or in the future at all. I mean, and that's always a piece of it as well. So that's a great point.
And so when you can change your mind, or you give yourself permission, all these possibilities come in that you probably didn't see when you were so focused on, I was driven, I was going. And then when you relax that, and the point that I take away from my personal experience was, you are doing something so important when you take a break.
That's right.
Which is self-care.
It is right. And it's not really a break, is it?
No, it's not. In your mind, you might not think that, because you don't get to see you. You're taking a break from seeing, your doctor, that you're not doing something. But that's the most important thing: self-nurturing, self-care, getting your footing again, and then regrouping with your team. I just love how thoughtful you are about that, and being able to hear that from you, that it's okay. It's almost sometimes you need outward permission.
Right. And sometimes people will come to me and ask. And so I would encourage anybody who's listening, if you feel like you need that, just talk to your doctor and say, I need a break. You don't even have to ask for it. They can advise. There are some situations where maybe a break is not, you want to set the terms of it. Maybe you don't want to take a 2-year break because there is some, ovarian aging kind of concerns, but most of the time, no. So also don't, feel free to sort of empower yourself and take that initiative to say, I need that time. Tell your doctor that's what you're going to be doing, and they'll work with you to make that break as useful as possible for you. And sometimes even people will do testing during that time, or sometimes not, but it's great. Yeah, I really, really think it's important for women to know that there is no set formula for how you recover from a loss and what you're required to do from a medical standpoint or a psychosocial standpoint after that.
So thank you so much. This was perfect, because once again, we're bringing the light to something that, a lot of women, and this, I felt that too. I felt shame and blame. And, just knowing that you're not alone, that, there's people to speak to about it, and that wherever you are is perfect right now, even though it feels awful. It's perfect for you to make a decision to move forward.
That's great advice, Kristen. It's great that you send that message out, and I hope a lot of people listen to this and sort of feel a little bit more assured in the way they're going to make their decisions going forward. And then we also just want to say how hard it is to go through a loss. It's devastating, and people don't know. So
no.
the other thing that,
And I think I share this too. It's around the time of the loss, or around the time that baby would have been born. Sometimes I get a little testy or prickly, and I'm like, what is wrong with me? And it's almost as if you still carry that with you, even though it's not in your conscious every day. And then I'll say, oh, I get it, because Thanksgiving would have been, now I know what's going on. And it's just acknowledging that. So I'm so grateful that you're on right down the road on Cape Cod, and you're with Boston IVF, and there's a satellite office here. But if someone wanted to reach out to you and talk to you, or schedule an appointment, what would be the best way to find you? I'm going to put all that information under the video, but if someone's listening and not watching.
Oh, well, that's great, Kristen. Yeah, so I'm with Boston IVF, as you mentioned. I'm a reproductive endocrinologist there, fertility specialist. I have an office in Quincy. I have an office in West Yarmouth, and I'm also in Foxboro. So the best way to reach me is call me at my Quincy office. That's my base. So the number there is 617-793-1100. And you can look that up online. But I would be happy to help with all sorts of fertility problems, pregnancy loss, even if it's just one. Happy to offer some services and some consultation, and sometimes even just to check in that everything's okay.
Right. Thank you so much. Thank you so much for being here. And this was the question of the week, and I'm so grateful for your time.
Wonderful. Thank you.
Thank you.
My pleasure. My pleasure.